Most of us are parents or will become parents sometime in the future. Whenever you first are at the hospital about to deliver, they're going to ask you, are you planning on formula feeding or breastfeeding? And I'm going to tell you why you should choose to breastfeed. First, there are unlimited benefits to baby. You're going to have fewer infections, including ear infections, any type of respiratory infections, colds, flus, anything like that. You also have less chances to have childhood leukemia or any other cancers. In addition to risk of many infections, breastfeeding has also been shown to significantly reduce the severity of any infections that you might have, and those benefits will follow you through adulthood or childhood, according to Ada Jarntair. Sorry, I butchered that name. And that's because it's filled with antibodies, especially in the colostrum, which is the very first milk that you do produce. It has exactly what baby needs every single time. Your breast milk is constantly changing the composition. For example, whenever you have a premature baby, they need a lot more fat than a baby who is not premature. So the composition of breast milk has a lot more fat particles in it. And there is a higher IQ linked to breastfeeding, according to breastfeeding versus formula feeding for parents. That's in Kids Health. And it also promotes skin-to-skin contact and bonding for both mother and baby while you hold the baby every time. Next is the benefits for mom. So it burns 300 to 600 calories every single day. So that's going to promote weight loss postpartum without necessarily having to exercise or add a lot more exercise to your normal routine. You're going to have lower rates of postpartum depression, and that's because of your constant skin-to-skin contact with your baby and bonding with your baby, as well as the release of oxytocin. And the release of oxytocin is going to promote your uterus shrinking faster, so you're going to have be less likely to have a postpartum hemorrhage. Your bleeding postpartum is going to be less than if you formula feed. And you're going to have a lower risk of ovarian and breast cancer, according to Cardi Anderson and Jessica Hartshorn. And cancer runs in my family, so that was a big reason why I decided to breastfeed instead of formula feed. It's going to delay your menstruation, which means that you're not ovulating, and that is going to mean you're going to have a natural birth control in place. They do still recommend that if you are using breastfeeding as a birth control, that you use a barrier method such as condoms or something of the sort, because you can ovulate before you have your first period and not necessarily know it and end up pregnant again. You're less likely to develop thyroid problems, heart disease, stroke, and other things like that. And you also can have bigger breasts. Some women find that a plus, and some people find that a negative thing. There's also some added bonuses that aren't necessarily for mother or baby, but are pretty awesome. It's cheaper than formula feeding because you're not going to have to pay for bottles or formula constantly. There are some programs that will help you pay for formula, but it's not going to be enough for your child for the whole month. Your biggest cost is going to be a pump, but most insurances will pay for a pump like this or this with every year and every child that you have, and some even pay for parts and supplies. Sorry. It's faster than fixing a bottle, so you're not going to have to heat up water, clean bottles all the time. You're not going to have to get up in the middle of the night to make a bottle and spend all that time. You can just pick your baby up and immediately start feeding them anywhere you're at. You're never going to forget to pack anything because you're not going to have to remember bottles or formula. You're going to have what you need to feed your baby anywhere you're at any time. You also get some extra break time to pump at work most of the time. There are some companies that try to get out of it, but legally, companies that have 50 or more employees are required to give you a space to pump and time to pump. It's also good for the environment because you're not going to have bottles to wash, so you're conserving water. And the formula canisters and old bottles that you throw away aren't going to be in a landfill, according to benefits of breastfeeding for mom at healthychildren.org. Also, some other things that I wanted to mention is breast size doesn't necessarily correlate to how much milk you can or cannot produce. A lot of people are under the impression that if you have smaller breasts, you're gonna produce less milk, and that is not true. And almost every woman can do it. If you're having pain or you feel like you're not filling up your baby or satisfying your baby, then I encourage you to see a lactation consultant, because most of the time it is a latching issue. And if you go talk to them, then almost always they're gonna help you out, and everyone can do it. I encourage every parent to at least try, because even the smallest amount of breastfeeding can have huge benefits for both mom and baby, and even dad. You're saving on some money for the formula wise. And I encourage every father to be supportive of breastfeeding from the start. Thank you.